Okay, just shut it off. No, I'm recording. All right, you're on.
Okay. My name's Linda Rabinus, and I had surgery on my 52nd birthday, September 6th. So it's been about 10 and a half months, and I have lost 109 pounds. You can see this. I'll pass this around.
Yeah, wait, hold it for the camera. Right. Oh, my goodness. Just hold it up just a little bit. Unbelievable. You look a little different.
I look different? I just bought a skirt just a couple of weeks ago that was a size 8. So from a 24 to an 8 in 10 months. Yeah. You're welcome to look at that. One thing that I liked doing too was I documented as I went, because now I can look back and say, 6 months ago, where was I? 3 months ago, where was I? So I would really recommend that you do that too. And then I have a lot of pictures along the way too, because I still even look back and can't believe that I used to look like that, because that doesn't even look like my face anymore. That doesn't even look like me. So anyway, I had a few issues. Mine was one, I ended up going on the patch. He always says if you feel like you're grouchy and mean and everything, I didn't have that, but I kind of had a sadness afterwards that when I call him, he says, well, put on a patch. And so I put on a patch, and I still kind of felt like that. And he said, well, put on a second patch. We're talking estrogen patches. When you have the surgery, it's almost like postpartum depression. Your estrogen level just drops really, really fast. And so to compensate for that estrogen loss, you put on a patch. And it's usually temporary. Mine was like 2 months, I think, at the most. And I took off not using 2, I used just 1, and then I kind of got off of that, and then I was like, oh, well, now I feel fine, so I didn't do that.
And can I give a little explanation to everyone else if you haven't heard about it? Women who are heavy have abnormally high estrogen. That's why women who are heavy face higher risks of breast cancer and endometrial cancer. So one of the nice things about the surgery is right after the surgery, the estrogen levels start to drop back to normal. That's good, but just like quitting smoking is good to protect you from lung cancer, it's great for your health. I just don't want to be near you when it happens, because you get a little grumpy when you're missing that cigarette, or if you quit coffee or something like that. So what we find in patients is, you said a good example is postpartum depression. In other words, if you think about that, it doesn't make any sense. You just delivered a baby, you participated in the miracle of life, and it should be a time of joy and celebration, yet some women inexplicably are sad. And we understand that now as being a depression related to the drop in the hormone estrogen. So in the same way, we see that drop in estrogen in some patients. About 1 in 4 of our female patients get this depression, or it won't actually be depression. You won't say depression. It can be just, I can't cope. Things seem to be too much. You kind of have trouble dealing. And what we find is a short-term use of the supplement estrogen patch. A way to think about it is just like if you had a nicotine patch to help with smoking. And so your story is one that we see very frequently, and I appreciate your willingness to talk about that, because many times when I tell women they need a patch, a lot of times they say, well, you're the problem, Dr. Rutledge, not me. That's what my wife used to say all the time. So,
you're my problem. Let me think.
How about your husband? What's he saying about things now? Is he happy?
Gosh. He loves to look back at the pictures too, because he says, I can't even remember you looking like that, and we're talking less than a year still, you know. Right. But he says, he looks at me and goes, you were just like a walking time bomb, which I was. I had high blood pressure. I don't anymore. In fact, I don't take blood pressure medicine at all anymore. I used to have to wear orthotics in my shoes because my feet were just like, smashed down, had plantar fasciitis. Well, now I can wear cute little shoes, and I don't have to have the orthotics in them anymore. When you think, my knees and my ankles don't hurt anymore, but they just are not carrying over 100 pounds anymore, pushing down that weight too. So I don't take that medicine at all. I just take my vitamins. I did have to go back on Lipitor for cholesterol. Right. I was off for 7 months, and we thought that was just going to, weight was just going to take it all off. but mine shot back up like 105 points in 7 months. And so my doctor said skinny people can have high cholesterol. And I have a really strong family trait of cholesterol. So that medication is really the only other one that I take, and my vitamins. And
we still have a little hope that as time goes by we might get the cholesterol down, because even though thin people can have high cholesterol, they don't have their first part of the bowel bypass. That's a real important area for cholesterol absorption. And so there is this opportunity, hopefully in the next coming year or so, that cholesterol will begin to come down, because there's this long-term effect. So we won't want to just ignore that, but recheck it in 6 months or a year, because there is a chance that we'll finally get it. We actually have a nurse who works with us. Those of you who've been through the surgery may remember Pam in the pre-op area. She had surgery with us and has been struggling with her diabetes for almost a year since her surgery, and finally is just about to get off her last medicine. So it sometimes can take a while for the surgery to have its impact, and you sometimes have to be patient. Many times we're blessed in that we can see diabetes and high cholesterol get better in a day, and I think Neil has a story about his medicines. I think that is it true? Do I remember right? You stopped all the medicines the day after, and that was it.
wow.
The surgery was my last time of medicine.
So see, we're going to put his video on. I'll have to edit yours out.
I talked about the patches.
Well, maybe keep part of your video.
Okay, all right.
The video where you're still having the high cholesterol, we'll have to cut out.
Oh, okay.
We don't like humanity failure on this.
That's not failure. That's just that.
There are no complications. No.
I think one thing that I really enjoyed learning about was the ghrelin hormone, which is your hunger hormone, because I always felt it was unfair that I was fat because I didn't feel like I ate so much more than everybody else. And I could try to lose weight, and I just didn't gain. I went to Weight Watchers, and I felt like I was starving on Weight Watchers. And so then when I found out there really is a reason why we're hungry when we're overweight, that the ghrelin level is out of sync, and then when he does the bypass, that's on the other side of the scale, and you don't even have to worry about it, and you can sit down and eat a saucer full of food, and it's like you just had Thanksgiving dinner, and you're satisfied, so you don't feel cheated anymore. So that's the part that's cool. So, no, you don't feel cheated about anything, and it's wonderful, and it's definitely worth the money, and I always say that he's like been one of my best friends because he gave me back life. So, any questions for me? All right, thanks.
Thank you.